Low back pain is a widespread and very expensive problem that America may be treating all wrong as doctors jump to the big guns too soon. What might be a better approach? Well, let's find out today. This is HealthCall Online, the place for extended versions of interviews you hear on our weekly radio broadcast, the HealthCall Radio Hour. This claim that America is over-treating back pain was published in an opinion piece on MedPage today. It claims that doctors are simply too quick to recommend invasive procedures when many patients do well with less aggressive, less expensive forms of treatment. So that caught my attention, and I reached out to the author of this piece. She is Christine Goertz, a doctor of chiropractic services, also PhD and a professor of musculoskeletal research at the Duke Clinical Research Institute. She is vice chair for implementation of spine health innovations in the Department of Orthopedic Surgery at Duke as well. So, Christine, pretty impressive credentials there. In your piece sparked some real controversy. Give me the big thinking. What is going on here? Why do you think that we are over-medicalizing low back care?
About 80% of people have low back pain at some point in their life, and up to 30% or more have low back pain. Adults have low back pain in any given year. It's the number one cause of disability across the globe, so it is indeed a very common and important problem. In 2016, the last year where we have complete data, low back pain and neck pain were the largest direct healthcare expenditure within the United States. So it's very common, it's very expensive.
That blows me away. The highest cost CPT code that we're going to face?
Direct healthcare expenditures, yes.
Wow, that's pretty surprising. So most of the time, I'm going to start out seeing my family care, my primary care doctor. Are these men and women up to speed on how to treat this?
Well, research shows that, in fact, that is who you are most likely to see is a primary care physician first for low back pain. And it's one of the most common reasons why people see a primary care physician. But in fact, primary care physicians may not be that best first choice. I hear from my colleagues in the medical profession that on average, they receive between 7 and 9 hours of training in how to manage people that have musculoskeletal pain conditions, including low back pain, and that what's commonly recommended now by guidelines and others are not things that are taught in medical school. And so it leaves primary care physicians without a lot in the toolbox.
Yeah, 7 to 9 hours of training for the number one problem doesn't sound very extensive. So what you just mentioned, there are some other things that are more effective. Give me the high points on those. What might we be talking about instead?
The American College of Physicians recommends treatments such as massage, acupuncture, exercise, including yoga and tai chi, spinal manipulation, and other similar approaches actually before trying prescription medications, that patients and physicians consider these practices first.
So that's interesting. I want to talk about each one of those in a second. People often go to their doctor and they're not really satisfied unless something happens. You give me a pill, you do something. Mm-hmm. Are patients part of the problem here?
Well, I'm not going to say that patients are part of the problem, because I think that we as our healthcare delivery system has done a really poor job of educating patients about best practices for low back pain, and may have provided them with unfair expectations about the ability of current treatment approaches to actually help with low back pain.
So if I feel like I need to have an X-ray or an MRI or some form of imaging to understand what might be at work here, is that wrong to think that right out of the box?
If I were in charge of the world, I would line up 5-year-olds when in gym class, and I would tell them, someday you are going to have low back pain and you will not need an MRI. I think we should start at the very beginning. Most guidelines that focus on imaging recommend that you not use either X-rays or MRIs, and for the first 4 to 6 weeks after the onset of low back pain, unless you have some red flags that may cause clinicians to worry that there may be something more serious going on. Actually, I don't want to say that low back pain isn't serious. That there may be something that requires more immediate medical attention.
Yeah, I get it. Low back pain is serious. I made it deep into my 60s before I started to feel it. So, and now I'm a little more sensitive to that complaint than ever. And most of the time it's associated with activity for me, and I suspect that's true for a lot of folks, isn't it? So are you suggesting that we just take some time and let it work itself out, or what should be the first step?
Well, a lot of it depends on how your low back pain presents itself. So there are lots of presentations. There are people that experience pain like you do. Perhaps you were shoveling snow and overdid it, or raking leaves, or mothers maybe picking up their child as he or she gets more heavy and experiencing low back pain associated with those activities. And in those cases, normally making sure that you maybe some ice or at the beginning and some moist heat, considering some stretching exercises or even over the counter NSAIDs, for a short term may be helpful. And in many cases, in most cases, low back pain will actually go away on its own in a couple of weeks. But those can be a pretty difficult couple of weeks for some people, because there are some who bend down to tie their shoes and they can't get up again. They're on
Yeah.
the floor with their low back pain, and
Yeah.
that's when more you may want to think about other treatments, such as acupuncture or massage or spinal manipulation.
Great. So let's say that happens to me. I feel that twinge, something just snaps. I think many of us have experienced that, and suddenly, oh, you can't move. The first step isn't to call my doctor. Do I reach out to a chiropractor or a massage therapist? What's your advice on that?
My advice, if you have decided that you need to see a clinician for your low back pain, my recommendation would be that you reach out to either a doctor of chiropractic or a doctor of physical therapy first.
A lot chiropractic care is all over the board. How do I know that when I go to that person, what do I need to look for in terms of their qualifications or experience level or special training?
Well, the first thing that I would do is to see if there is a doctor of chiropractic within your health system. So, for instance, there are doctors of chiropractic available at Duke University Health System, at Harvard, at I think University Hospitals. So many health systems, there are doctors of chiropractic available in the Department of Defense and in the VA. So that may be one place to start. You can ask your physician if they work with a doctor of chiropractic to get a recommendation from them. If you're really starting completely from scratch and you don't have those resources, I think I personally would recommend that you call the doctor of chiropractic and have a conversation with them, someone who is local to you, and ask them, do they follow evidence-based clinical practices? Do they conduct a comprehensive history and examination and come up with a diagnosis and discuss the various treatment options that are available given that diagnosis? Do they work closely with primary care physicians, with specialists such as surgeons or physiatrists, but also with clinicians such as acupuncturists or massage therapists, to make sure that you're getting the care the individualized care that you need. I would ask about imaging and whether they follow best practices on imaging, based on the conversation that we had earlier about waiting 4 to 6 weeks to see if if the treatment approach is working. I would be wary of chiropractors who tell you that you need a whole lot of visits up front without seeing how you react to an initial 2-week, say, course of care, or who are asking you to pay especially large amounts of money up front for a long-term course of care.
Yeah, you just put your thumb on a lot of concerns people have about chiropractic care, and some of the folks out there are some of the operators who have muddied the waters. So I appreciate your sensitivity about that. You've mentioned acupuncture a few times. I think this gets to the issue that you mentioned in your piece about we need to align incentives within the healthcare system. So I assume you're talking about financial incentives there.
Right.
So are insurance companies going to respond and pay for acupuncture?
That it is starting to be much more common that insurance companies pay for acupuncture. In fact, CMS now has at least limited coverage for acupuncture for people that have chronic low back pain.
Tell me how that works. What do you actually do? I mean, I know you're inserting, fine little needles, but what's actually happening there?
Well, I'm not going to say that I'm an expert in how many acupuncturists approach that. So I'm not able to give the Eastern philosophy for that. But what I can say is research indicates that when the needle goes into the tissue, it may somehow have an impact on the connective tissue and may help it, let's just say, relax in a way that can relieve low back pain.
You've mentioned massage therapy. Tell me what role that should play. What should I expect?
Massage therapy is one of the treatments that's recommended by the American College of Physicians for treatment of low back pain, and it can help to relax the muscles within the low back and surrounding the low back, and there are some studies that indicate that it can help with just overall relaxation and feelings of well-being also.
So I want to get back to the issue of financial incentives. Tell me more about how that's not in alignment with the idea that we want to do minimal care first and see how the patient progresses.
Insurance companies are very likely to pay for spine surgery, for corticosteroid injections, for primary care visits, for prescription medications for low back pain. But the truth is that many of those things do not work very well for a majority of people, and especially in the long term. And we're starting to find out that some things, one of the reasons why I am concerned about imaging, for instance, is because there are now studies that show that if you have early imaging, if you have early corticosteroid injections or a surgical consult, that if you have acute low back pain, it may be more likely to turn chronic. So one of those conditions where your back pain does not resolve on its own, but instead can last for weeks or months, or for some people even for years. And so we're learning that getting the right care up front is just incredibly important.
So what is early imaging? When should that be called for? Is it after I've gone through acupuncture, massage therapy, chiropractic care, maybe physical therapy, and I'm not getting results? Is that when I should be thinking about imagery and some additional steps?
That is when I would be thinking about imaging. Again, there are exceptions to that. So if you've been in an accident or a fall, then imaging should be considered. If you have some symptoms that are worrisome or consistent with a cancer diagnosis, then you would want to have imaging earlier. But for the most people with low back pain, that's not the case. For the vast majority of people with low back pain, that's not the case. And so I would recommend avoiding imaging for between 4 and 6 weeks and try a course of care. And the studies show that these things that we're talking about, spinal manipulation and massage and acupuncture, have similar outcomes. And so they, it's about finding something that works for you. If you hate needles, acupuncture is probably not what would be best for you. If you really don't like to be touched by strangers, probably massage is not your best option. But luckily you have choices.
Yeah. So, not to make this all about me, but of course, it's always all about me, right? It is for all of us. But so I occasionally have that low back pain associated with activity. And so I'm, relying on Aleve and ibuprofen and all that kind of stuff. It's not every day, but a couple days a week. Is there any harm with that? Should I be reaching out and looking for a more professional input on what might be my problem?
I would recommend that you consider doing that. I would recommend against taking NSAIDs, especially as frequently as it sounds like you are. For one thing, we've known for a long time that we should be worried about especially gastrointestinal bleeding with NSAIDs. And I hate to point out that that's especially true for older adults. We also now know that people that are taking NSAIDs may be more likely to have heart attacks. And now there's we're just beginning to see a signal that it's possible that people that have acute low back pain who take NSAIDs early on may actually be more likely to transition from acute to chronic low back pain. Still a lot of research that needs to be done in that particular area, but definitely something that needs to be considered when we're thinking about our best treatment options.
Yeah, I'm aware of a number of cases in which kidney cancer or some other ailment is discovered as a incidental finding once they are looking at back pain. So it's when should you push for imaging?
Well, if you have a good clinician, you shouldn't have to push for
Because they're going to be
imaging.
pushing you. I get
I
it.
would recommend that you follow your clinician's guidance on that. They should be aware of the guidelines and know and where I would push is if they recommend early imaging. I personally would be more concerned about pushing back against that early imaging and asking for a course of care prior to that, unless the clinician can articulate specific reasons why in your particular case earlier imaging would be warranted.
So after I've gone through all the things that we've discussed, the non-invasive procedures, are there some that just the stats are saying really aren't performing up to the risks involved?
Do you mean with more conventional care? Because
No,
I
I
would
mean
say
with
pretty
more
much
invasive
everything.
care. Yeah, no, I'm talking about more invasive care. Is there, I guess the blunt way to ask this question
Okay.
is there a procedure you just would not have?
I would not say that there is a procedure that I would not have under any circumstances, because again, every case is individualized. I think sometimes that low back pain is about as individualized as we are, and every person is going through just a little bit of a different experience. But I would be very, very reluctant to have spine surgery unless I had symptoms that were consistent with something that's called cauda equina syndrome, which is a total loss of bowel and bladder control, or really severe progressive neurological weaknesses. Those are indications when surgery might be warranted. If those conditions are not present, in many cases people do as well if they do not have surgery as they do if they have surgery at least in the long run. And obviously the risks of surgery are greater than more conservative options. And people that have surgery, depending on the surgical procedure that you have, it may make you more likely to have additional surgery in the future, especially if they're fusing your vertebra together. What that does is it puts more strain on the vertebra above and below the surgical procedure that can end up being problematic in the long run.
Yeah, I just looked at the national average cost for that type of fusion surgery exceeds $80,000.
Right.
So there's a lot of financial incentive to avoid that, in addition to all the life-changing subsequent challenges you might face because of that surgery. So I get there.
Just one other thing with surgery, if you don't mind, is that
No,
it's
please.
very common to end up having opioids after spine surgery, at least for a short period of time, and
Yeah.
that is always a risk.
Yeah, you bet. Is there a trick to getting, or a process by which I am more likely to get reimbursement from the insurance carrier? Is there a sequence that I have to follow so that I'm not fighting that battle down the road?
That's a really good question. So one thing that I would absolutely recommend is talk if you're seeking care within a healthcare system. That system will have people available that you can talk to about what your insurance will and will not cover. You can call your insurance company directly to ask them what the options are, if there are clinicians, physical therapists or chiropractors or even acupuncturists that are within their network, so that you're able to access those providers and make sure that you understand the costs up front. I would urge you to consider calling your elected officials and letting them know that you're not happy about the fact that there's a disconnect between best practices and what your insurance companies are covering, because in many cases that is the situation that we're in.
Yeah. I know that Duke's Spine Health Program is trying a pretty forward-thinking approach. Tell me how that works, and maybe that'll set an example for others to follow.
Happy to tell you about that. The Duke Health Program is focused on the overall vision of making sure that the right patient is seeing the right provider at the right time and at the right cost. And we're really fortunate at Duke that we have a full range of providers. We have everything from acupuncturists to the best spine surgeons in the country, if not the world, and everything in between. So our focus is to make sure that patients have access to things like mindfulness and stress reduction and exercise. We haven't talked very much about exercise so far, but that is incredibly important. And that's one of the things that I personally would recommend for you with the type of low back pain that you are describing, is making sure that you are strengthening and stretching the muscles around your back and your whole body, really, to help avoid getting those. I predict that if you were exercising on a regular basis, that your episodes of low back pain may end up being just a little bit less frequent. But we have access to that care. Massage therapists, acupuncturists, specialists in mindfulness. Then we also have a doctor of chiropractic and physical therapists who are specifically trained to focus on patients with low back pain and best practices. And then if that doesn't work, we call our physical therapists and our chiropractor or primary spine practitioners if a course of care with those clinicians is not effective. We work closely with primary care. The truth is that many people with low back pain, many people in this country don't just have one condition. You're not likely to have you don't have just low back pain. You may have low back pain. You may be a little bit overweight. You may have diabetes, and we've found that the opportunity for primary care physicians and our primary spine practitioners to collaborate together can lead to best outcomes for our patients. And then if in fact this first this first course of care is not effective, then we have physiatrists who are able to offer corticosteroid injections, or some of them are also acupuncturists. And we also have, as I mentioned before, we have some of the best spine surgeons in the country.
Well, that sounds like a model for a lot of folks to follow at Duke.
We're
Christina, I
hoping.
appreciate you being with us.
Well, thank you, Lee. I really appreciate the time to talk today.
And I will put a link to the Duke Spine Health Program in the show notes for this episode if you'd like to learn more about how they're managing it. And if that can set an example for you to follow, that might be a good thing. Christine, again, thanks.
Thanks, Lee. Really appreciate it.